Good evening, everybody. Thank you for showing up for our presentation tonight, our little forum on medical debt. We're really glad to bring this to you. I think it's a very important topic, especially what's going on in our country with lots of layoffs, cuts, job cuts, downsizing, whatever you want to call it. Especially with the federal government cutting benefits, to Medicare, Medi-Cal, that type of thing. So thank you for showing up. We have Pastor Dan, has a couple of words for us.
I don't often get applause. That's nice. I apologize for the heat in here, but it's the same temperature as it is outside, so it is what it is. We tried to give fans around. That moving the air helps a little bit. The bathrooms are right out this door. I do want to welcome you to Grace on Third. We are a Christian, Protestant, Methodist congregation of multi-languages. This is not my forum tonight, but I do want to say if you saw the dragon coming in, that's because we've got a theme this month of dragons in the Bible. And dragons can be water serpents, or they can be chaos monsters. They can be government or rulers or anybody that causes chaos, including medical debt. So what we're facing is a dragon from my perspective. But I welcome you. Hope you enjoy your time here.
So a little bit about me and why I'm hosting this evening. So I am the president of the Gay Elder Circle. We kind of do mentoring for gay men and adults and youth. I'm also an advocate for SAGE, Service Advocacy for Gay and Lesbian Elders. We're usually doing things, advocating at the national level on federal issues. I'm an education ambassador for the National Resource on Aging. The light bulb shaped one is for the LA County Department of Mental Health. They have an LGBTQI2S+ subcommittee. I'm on that subcommittee. I'm the oldest person on subcommittee to making sure that older adults are getting their mental health needs addressed. The earth-looking one is Queers for Climate. That's my environmental justice side. The pink one with the thing with the fist is the Pink Panthers, again, LGBTQ advocacy. And then locally here in Long Beach, I'm a member of Citizens Climate Lobby and Long Beach 350. So I have a huge advocacy side for social justice and environmental justice. Very, very involved. So going back to HR 1. HR 1, or the Big Beautiful Act, as it's officially called, was signed on July 4th of this year by the White House administration. It includes provisions that impact Medicare and Medicaid with various effective dates. So that means the dates are staggered throughout the document. And so I really want to stress that whatever you hear from the White House administration can be scary, it can be frightening, but it's actually what's signed and in the document that we need to pay attention to. So effective immediately, or July 4th, 2025, they started making changes to the Center for Medicare Medicaid Services, and that was to start looking at eligibility for that. So, Medicare, Medicaid, immigration, child care, which is really concerning because there's a number of young children that are on Medicare, and then taxes and how funds are distributed. So specific dates, here's some example of specific dates. And so Medicaid expansion, so temporary financial incentives for states to adopt newly Medicaid expansions has been eliminated. Restrictions on eligibility for non-citizens. So what we're looking at, what they're really saying is our immigrant population, or maybe even our DACA population. So this is really concerning because it seems as though that definition is changing on a regular basis, or weekly or hourly sometimes. So it's how does the White House administration really defining non-citizen? Emergency Medicaid matching payments are being limited, and Medicaid eligibility determinations. So redeterminations. So every year, if you're on Medicare, Medicaid, Medi-Cal, you have to requalify basically. So what they're doing is they're making you like shortening the time limit. So you have all this paperwork to fill out, and it's really difficult for that. And then in 2027, again, all states need to establish requirements for eligibility. And what they're really saying here indirectly is, again, they're referring to immigrants population, and that, we love our immigrant population. Medicaid will reduce the amount of retroactive coverage. So sometimes, you apply for coverage and then, it takes a while for the paperwork to go through. So then they're not going to honor it retroactively. So the law is freezing provider tax thresholds for 2 years, and it'll reduce a little annually until 2032. So this definitely impacts our younger population because they're going to age into this. So kind of like make notes to yourself to follow up with your congressional representative. And again, eligibility verification steps up. They're working with Social Security to look at the master death files with the Department of Social Security because they're looking for fraud. Does more than one person have a Social Security number? Is that person really dead? Did it expire? And cost sharing. So cost sharing, we're talking about your out-of-pocket money for, co-pays for office visits or co-pays for medication. So expect a lot of changes in that area. And then really what we want to look at now, there's been more and more news coverage on Medicare Advantage. And so what's happening is they're kind of tightening the reins on Medicare Advantage. Medicare Advantage has a nasty history of upcoding patients, and they don't need to be upcoded. So they make your symptoms sound worse, which generates more profits for them. So Medicare Advantage, for people like myself who advocate against Medicare Advantage, it's really truly profits over patients. And one of the things, if you notice, the first hospital there, or the first medical institution is Scripps in San Diego. But they're not the only ones, and there's other, health providers there. So they're dropping Medicare Advantage patients because, for a number of reasons. First of all, I'm sure most of you have heard of United Healthcare. United Healthcare is using artificial intelligence to determine things like how long you should have treatment, denial of care, denial of treatment, what kind of medications can you take or not take. And when it comes to health providers like Scripps or Bon Secours, Mercy Health, is that they're paying less in reimbursement to the medical provider. And so all these things are compounding, and it's really frustrating doctors and hospital facilities when it comes to reimbursement and how long it takes and all the denial of care. So that's really what's happening. What you're seeing on this page is really what's happening. That's why you're seeing this. So this actually makes Medicare Advantage really kind of interesting because now what they're doing is they're looking at populations and can we cut treatment in this geographic region or that geographic region? How many patients do we have there? Most of the cuts that you're seeing are in rural areas, which are really detrimental to our immigrant populations who work in, here in California in the Central Valley, where it can take a long time to get to a medical clinic or a hospital. So there's reasons to be concerned. The same thing would apply to Native American sovereign states and stuff like that, where the clinics are not easily accessible. So one of the other things this is indirect of HR1, and that's co-pays and deductibles. With the screws kind of being tightened down, we can expect copays to go up and deductibles to go up. And this one clearly documents that copays for Part D prescription drugs will increase $100 in 2026. And supplemental benefits, like if you're like on Medi-Cal, you might hear like older adults talk about silver sneakers, I can go to the gym for free, or I get that for free, I have zero copays and that kind of stuff. These things, they're gonna start to see them disappear because, Medicare Advantage providers want to, get that profit. So the profit is going to be difficult to get for them. So one of the things that I advocate for is CalCare. Show your hands. Anybody familiar with CalCare? Nobody's familiar with CalCare. So anybody familiar with how they treat medical services in Canada or the United Kingdom? Right, there you go. So they have a universal health plan. Everybody pays into universal health plan. You go see your doctor, you go to the hospital, and then the state pays for your services. So it's called single payer health plan, right? We're literally the only country in the world that does not have single payer health plan in the world. So we are purely a capitalistic, profit-driven medical industry in the United States. So currently, it's gone through many iterations, and the current iteration for CalCare is AB 2200. So if you have time, I would encourage you to look it up, learn about it. There's a few definitions of what it is right there on the slide. But it's something definitely to learn about and support if you believe in single-payer health plan, where you're already paying. If you're working and you have deductions on your paycheck, one of your deductions is for Medi-Cal. So CalCare that Medi-Cal deduction on your paycheck would actually be CalCare for California. So that's how you would be paying for your medical care. So that is for my portion of this. So what I'd like to do is introduce Mr. David Zhao. David is with Public Counsel. He is an EJW Fellow, which is short for Equal Justice Works. And as an EJ Fellow, they seek to meet the unmet legal needs of marginalized communities and provides opportunities to positively impact vulnerable communities. I know personally that he provides community workshops on understanding how medical debt works and how to identify and avoid predatory medical debt lending. You're going to get a nice education this evening. He works with the Consumer Rights and Economics Justice Department within Public Counsel, and he's also a graduate of UCLA School of Law. So with that said, where did he go? Here's David.
Thank you very much, Bill. You're good. Okay, great. So like just mentioned, I'm an attorney at Public Counsel, which is I'm an attorney at Public Counsel, which is a legal aid organization here in Los Angeles County. So we provide free legal services to folks that live anywhere here in LA County. Today I'll be talking about your legal rights regarding medical debt. Just as a reminder, this is an educational workshop, so I'll take questions at the end, but if you have any specific legal questions about your situation, I can't provide legal advice right now, but we can probably call you back or have a separate meeting with you later. Today we'll be talking about basically the ins and outs of medical debt, and we'll start with just a definition of what medical debt is, which is it's any money that you owe for medical services from hospitals, care providers, or financial services companies. So what that's going to look like is hospital bills, obviously, doctor or dentist bills, and then you're also going to see now more and more these CareCredit cards. Has anyone seen these before? Yeah, so these are called medical credit cards. They're basically credit cards that are specifically used just to pay for medical things. And we'll talk about it a little bit later on. And the last category is going to be payments for medical services or products with your regular credit card. So for example, if you go to CVS to pick up some medication and you pay for it with your credit card, that could technically be a type of medical debt. So the most common question we get is, can medical debt hurt your credit score? a lot of people get really worried. They say, they don't want to go to the hospital or the emergency room because they're worried if they can't pay, it'll ruin their credit score. Well, the good news is in California, starting the beginning of this year, January 2025, there's a new law that went into effect where basically medical debt is not really allowed to show up on your credit report anymore. It's a little bit more complicated than that, but generally, your first two categories of medical debt, so hospital bills and doctor and dentist bills, these cannot show up on your credit report anymore. So if you go to the ER and have like a big bill and you're not able to pay, that cannot lower your credit score. Similarly, if you have a doctor or dentist bill and you're having trouble paying it, that cannot impact your credit score either. However, the bottom two categories of debt do still show up on your credit score. So anything with a medical credit card or a regular credit card that you're using to pay medical costs for, that may lower your credit score if you're having trouble paying that. So generally we tell people to, as much as you can, try to be directly billed for medical things and use credit cards as sort of a last resort, or if smaller payments or payments that you're pretty sure you'll be able to pay off. Okay. So today there's a lot of different types of medical debt, but today we're going to talk about the big two that we often see as lawyers that folks are either being sued on or having a lot of legal issues with. The first is going to be hospital bills. So that's emergency room bills, or if you go to the hospital to see a medical provider at the hospital. And the second is going to be these CareCredit Cards, which are these medical credit cards that we're now seeing pop up in dentist's office, chiropractors, veterinarians. It's very popular as well. Okay, so the first is, how do you get help with your hospital bills? What legal rights do you have around hospital bills? Has anyone heard of financial assistance before or charity care? Okay, so it sounds like you're familiar. So in California, there's a law, the California Fair Hospital Pricing Act, and it requires all hospitals in California, both nonprofit and private, so it doesn't matter which hospital you go to, government hospital, veterans hospital, they have to provide financial help to patients who qualify, and that either means free or discounted medical care. So that means either free care, so 100% bill reduction of your ER bill, for example, so it's going to go down to 0, or discounted care, which legally means they have to reduce the amount of your ER bill, and then the rest that you do have to pay, they have to put you on a payment plan, and it has to be affordable, so they can't have any interest on the payment plan. And the payments have to be capped at 10% of your monthly income after basic living costs. So the next question we oftentimes get is, well, how do you know if you qualify for financial assistance? So there's kind of a little formula. The first is that you need to be at or below 400% of the federal poverty level. So for a family of 4, that's $128,600 this year. For an individual, that's about $62,600 per year. And if you're uninsured. So if you meet these two criteria, then the hospital is legally required to either give you free care or discounted care. Okay, well, the next question we get is, what if you do have insurance? Well, you can still get financial assistance or charity care. You'll oftentimes, I didn't clarify, hear the term used interchangeably. So financial assistance is the same thing as charity care. Hospitals use different terms. So if you have insurance, if you have Medi-Cal, private insurance, Kaiser, whatever, you still must be given financial assistance if these two things are met. You're at or below 400% of the federal poverty level, and your insurance, even though you're insured, your out-of-pocket medical costs, so the amount you pay yourself either for deductible, co-pays, whatever your insurance doesn't cover, is more than 10% of your family's income. So if your hospital bill after insurance is still like, 20% of your income, or, even just 10.1% of your income, then the hospital is legally required to give you financial assistance. Next question we get is, how do you know if you're going to get that free, like $0 bill, or just be on the payment plan, the discounted care? And this is going to be up to the hospital. So the law doesn't really set out exactly what the rules are. Just that if you meet the eligibility, the hospital has to give you one or the other. And then the hospitals individually have their own policies around, which bucket you fall into. So you're going to want to check with your hospital's website or their billing office to see the policy. So it's kind of hard to see here. This is an example of one of the hospitals in LA, and they say if you're at or below 200% of the federal poverty level, then you get the free care. And then if you're from 200 to 400, you get the discount. Okay, now but what if you make more than 400% of the federal poverty level? So what if you make like 401%? It's still not really a great position to be in with a large medical bill. Well, the good news is that actually you might still qualify. Some hospital rules are more generous than what the law requires. In fact, many of them are more generous, especially the nonprofit hospitals. So you want to check with your hospital's website or call their billing office to see what their individual policy is. And it's hard to read here, so I'll summarize. But this is Cedars-Sinai in Los Angeles, and they actually offer financial assistance up to 600% of the federal poverty level. So even if you're above the 400, even up to 600, you can still get a lot of your bill reduced. Okay. So how do you get financial assistance? Unfortunately, in California, it is up to the patient to know that they qualify and to ask the hospital. The hospital's not going to do it for you, even though that's how it should be. And this is why a lot of people don't realize that they're eligible for financial assistance, because you kind of have to do a little bit of work yourself. So first, you got to go to your hospital's website or their billing office and request the application form and their policy. They're required to give it to you in your language. You got to fill it out and mail it to the hospital. And then you need to attach pay stubs or income tax returns to show that you qualify in that federal poverty level amount. There's a great nonprofit that we also recommend you use called $4. It's called, you can go to them at $4.org, and they actually have an online tool where you can just fill out your information, and they'll actually send the application to the hospital for you, and it's free. And they have a database of every single hospital in America, so it's definitely the ones here in California. Okay, some what if questions. A lot of questions we get about financial assistance. What if your hospital bill is from a long time ago? There are no time limits for help. We have helped people with hospital bills from 2015. I helped someone with a hospital bill from 1995. Could go way back. What if you've already made some payments? The good news is that if you qualify for financial assistance, you submit the application and the hospital's like, oh yeah, this should have been reduced to zero, and you've already made a couple payments, they actually have to refund you all those payments. So you're going to get back the money that you already paid if you qualify for financial assistance. What if you're undocumented or not a resident? You do not have to provide your immigration status or residency for financial assistance. There is no requirement under the law. The hospitals cannot deny you because of your documentation or residency. So if they ask for it, leave that part of the application blank. It will not impact your application, and they really shouldn't be asking for it in the first place. So whether you're undocumented or you don't even live in the area, let's say you were visiting the Bay Area and you had to go to the ER there, but you actually live here, it doesn't matter. You can still get financial assistance. All right, a couple more things to consider. Getting your bill sent to collections. This happens a lot here in LA, as the hospitals will send people's medical bills to collectors to kind of harass you to get the money back. Bunch of rules about this and your legal rights. Basically, hospitals cannot be sending the bill to collections until you actually get a notice with your bill and they've given you an application for financial assistance and you've actually been denied that financial assistance. So you can't be sent to collections if the hospital doesn't know whether or not you would qualify for, a payment plan or a $0 bill. That being said, if they've sent it to you and you kind of have ghosted them and haven't responded for half a year, then yeah, they can send you to collections then. So try to submit the application sooner rather than later if you're worried about dealing with that. The other thing to know is that hospitals cannot send your bill to collections if you're still negotiating your payments. So even if you've called their billing office and said, hey, that bill's really high, could I get a little bit off? Or even if you're just I don't think I got all the treatments that you're billing me for, any communication like that automatically blocks them from sending your bill to collections. Okay. Last thing, scary thing, what we deal with, hopefully which you will never have to deal with, is whether you can be sued for your hospital bills. It does happen. Something to know that's, hopefully makes you less worried is that you can't be sued until like half a year after your first bill. So if you're really worried about not being able to pay and like being taken to court, don't let that stop you from, getting the healthcare you need. You'll be fine for half a year. They can't do anything about it. And, worst comes to worst, and you do get sued and you lose the lawsuit. Hospitals in California, if you should have gotten charity care or financial assistance, they cannot take your wages or your property to repay hospital bills. The most they can do is, try to see if you have money in a bank account. But even then, there's, a bunch of other legal protections, which I'm happy to talk to you about later. No one can go to jail for hospital bills, by the way. Sometimes people are worried they're going to get sent to jail, but that's illegal. Yeah. Okay, if you think your rights have been violated, anything that we just talked about, you're like, that didn't happen, that's not working, you can always come to us, public counsel. We'll help you, but you can also do it yourself. The California Department of Healthcare Access and Information is the department that regulates our hospitals, and they're responsible for fining the hospitals or requiring the hospitals to give you the financial assistance if you were eligible and they just didn't do you right. And actually, the way the law is written is that if you should have gotten financial assistance and the hospital didn't give it to you and you made payments on it and you go through this complaint system, the hospital actually has to reimburse you with interest. So you're going to make some money. I've never seen that happen though, so. If it works for you, please let me know. But that's the way the law is written. Okay, I'll pause there before I go into the next part of the presentation. Does anyone have any questions about hospital bills? Yeah. DNV, sorry? Oh, if you're using it to do that. Yeah, if you're paying for that with a credit card. Yeah, if the bill is coming from the hospital, so for example, like whatever hospital you go to is providing that equipment and they're billing you through the hospital, that's not going to show up on your credit score. That is not, that company is not a hospital and is not itself a medical provider. The way the law is written, I don't agree with it, but that will be like a regular line of credit. Yeah, that's a really good point. So Equifax, TransUnion, and the third, which is escaping me, like major credit reporting agency, have on their own decided that they will not report any medical expenses on your credit under 500. Sorry? Experian, thank you. Yes, that's the third one. That being said, the law I just mentioned in California kind of makes that not that relevant anymore, because in California, actually no medical debt, even over 500, can show up on your credit score anymore. That rule is more useful for people who live in other states, unfortunately, where they don't have those laws at all. But even the credit reporting rule with Experian, TransUnion, that is still only for direct medical debt. So medical bills from a hospital or doctor, it wouldn't cover anything on a credit card. Yeah. Yeah. They shouldn't be on your credit report. It's still worth pulling your credit report, and we actually recommend people use annualcreditreport.com instead of Credit Karma or like any of those other sites. It's called annualcreditreport.com, and it's a website that's actually mandated by the government. And so what it does is it lets you pull one free credit report every week. And it will let you pull a credit report from all 3 different credit reporting agencies, and it won't ding your credit, so it won't impact your credit score. And yeah, I would recommend going to there, pulling a credit report, seeing if there's any medical bills on it, in which case you should reach out to those medical providers or to the credit reporting agency and let them know that it shouldn't be on there. You might see it there, especially if it's like really old. Otherwise, to be honest, because it's not going to impact your credit score, and if they haven't been pursuing you for collections, leave it alone. Like, why would you want to pay it if no one is trying to ask you to pay it and it's not on your credit score? They never got back to you? And then, so check if it's on your credit report, and if it's not there, then you have no... Let me be careful how I say this. Why would you pay? If they do come out of the blue, then right, then you may have a number of protections, or they may be going about it in an illegal way, in which case you still are not obligated to pay if they're not pursuing it in a legal way. Exactly, yeah. There's a statute of limitations on suing you. So they could come out and 20 years later try to collect from you by sending you letters and things like that. Statute of limitations applies to like a lawsuit. So it would be very difficult for them to sue you in court over a bill from 20 years ago. But they could technically still try to pursue collections outside of court. Does that make sense? In California, it's 4 years. Yeah. It's not a government agency. They think there was a law that was passed, I can't remember when, but it basically required that the credit rating agencies like create a website for Americans to use separate from their own individual websites. And so we recommend people use this website, annualcreditreport.com, because it's like just for pulling credit reports. Credit Karma is not really a great thing to use because Credit Karma is its own private company and they're trying to sell you products through the credit report. So a lot of times people get like tripped up with that. It's okay. Like, yeah, you're not gonna. It's not a bad thing. It's just if you just want a clean credit report, they're not trying to sell you anything. Just use annualcreditreport.com. Yeah. Yeah. Go ahead.
Just received a call for collections, but it was from physical therapy. Would that still be considered?
Yep. Physical therapists are medical providers under the law, so that shouldn't show up on your credit report. It sounds like if there's more to the story, maybe we talk about it a little bit after, but generally like that type of, a physical therapist is under the law a medical provider, and so bills from a physical therapist should not show up on your credit score. That being said, a physical therapist is not, unless they're working through a hospital, like they're employed by the hospital, you're not going to get financial assistance or charity care for a physical therapist. Good question though. Okay, any other questions? Okay, this is the last part of the presentation. It is shorter, but this is dealing with CareCredit Cards. So these are these new medical credit cards that you're going to see. Actually, physical therapists will use them sometimes, chiropractors, but we mostly see them at dentists. And let me explain what they are. So basically, a CareCredit Card is a credit card. It's run by this big bank called Synchrony Bank that dentists and doctors offer to patients to pay for medical or dental bills. So if you can't afford or pay out of pocket or are insured for something, oftentimes the medical provider will be like, oh, well, you can just pay for it with this credit card. And they will offer it to you themselves. Like, it's not the bank, you don't go to the bank to get the card, like the medical provider will in their office give it to you. Their rates are often much higher than regular credit cards. They oftentimes have rates at or over 30% instead of your 20% usually. And they're often limited to only medical uses. So if you sign up for one of these cards, you can't be using it, at the Home Depot. You can only use it at your dentist's office or to buy like pharmacy, things like that. And then, because it is a credit card, it will affect your credit score. So we really encourage people to think about if you're going to struggle to pay at these higher rates or if you're going to miss payments before signing up for one of these cards. I mean, our health insurance system is so broken. I understand sometimes you need treatment, and if you can't afford it, this is the only way to afford it. But I think that's part of the reason that so many people get signed up for these cards is because they're not given that time or ability to really think if they'll be able to afford it or not. So some of the problems that we see with folks that come in with these cards is that they're often signed up for these cards without even knowing it. So that's why I do want to talk about it. It's very common for dentists to sign people up for these cards without disclosing that it's a credit card. They'll oftentimes call it a payment plan. And folks think they're being signed up for a payment plan directly with the dentist, but they're actually being signed up for a credit card with the bank. They oftentimes have what are called deferred interest plans. These are very tricky. They basically let you avoid paying interest for a year. But if you don't pay the entire amount by the end of that year, they'll actually charge you the full interest on the initial amount that you got on the card. So like, let's say they charged $1,000 to the card and you're making good payments for the rest of the year. You pay off $999.99. But that last first day of the next year, you still got 1 cent left on the card. They'll charge you 30% on the initial 1,000. So they'll just suddenly add $300 to your card, and then the interest will start accruing from there again. So a lot of times people are really, really surprised. They have huge, huge interest accruals. Technically in California, it is illegal for a dentist to sign you up for a card with this type of interest plan. They should only be signing you up for cards with like a regular credit card interest plan that starts, first month, second month. But the fact that it's illegal is not stopping a lot of medical providers. It's still happening a lot, so just be aware. And then if you're not able to pay off the card, Synchrony Bank may sue you. They're actually in the top 10 companies that sue people for credit cards in California. They're up there with like Citibank and Wells Fargo, so they do be suing people. Just so you know, CareCredit is the big company. There's 22,000 medical practices across California that use CareCredit. 67% of dentistries in California use CareCredit. Almost half of podiatries, a lot of chiropractics, physical rehab, derms. We haven't seen it in hospitals. We haven't seen it with primary care physicians, pediatricians, like those types of doctors or medical practices. It hasn't been an issue so far, but really watch out when you go to the dentist. Oh, and I mentioned earlier veterinarians. It's very popular with veterinarians as well. They sue a lot of people. You can see here, Synchrony is one of the big banks that sues a lot of people in California. I'll skip that one. Okay. So some red flags to watch out for. The first is if they're offering you a payment plan at the dentist's office. This might be a credit card. The second is if they're giving you an iPad to sign during or after the appointment. That's a common tactic we see. It's really normal to sign forms like before your dentist appointment. That's totally normal. But if they're giving you forms to sign like halfway through, and they're giving it to you on an iPad, or they're giving it to you on like a clipboard where they've highlighted where you need to sign and they're flipping through the pages just to where you need to sign, a big red flag. And then if you're being rushed by the staff to sign it, that's also a red flag. They probably don't want you to read what you're signing. Okay, some patient rights that you should know, some of your legal rights around these cards. So they are regulated here in California. The first is that you cannot be signed up for one of these credit cards while you're asleep. It happens. People are signed up for these cards while they're under anesthesia or sedated. Very illegal. If this happens to you, please come to us. You have to receive a treatment plan first, so you can't be signed up for one of these credit cards unless the medical provider has given you like a written treatment plan of all the things that they're going to, give you and that are going to be charged to the card. Everything has to be provided in your language. So if you're going to the dentist and they're speaking Spanish with you, they can't be giving you English forms to sign. That happens pretty frequently. That's illegal. And then if you're on Medi-Cal, you get another set of protections, or Denti-Cal if you're going to the dentist, which is that they need to, the provider has to first try to get stuff that's covered by your insurance. Then they have to try to get stuff that could do a similar job that's covered by your insurance, an alternate treatment. Then they have to tell you that at the end of the day, you have the right to refuse any services not covered by your Medi-Cal. And they have to like literally tell you that. Last set of rights is no surprise charges. So you can't be charged on these cards for treatments that are more than 30 days in advance. This happens a lot. People will be told like, oh, you just come back in like a month and we'll like give you like dentures. And then they'll charge them for the cost of the dentures then. That's illegal because you haven't gotten the dentures yet. And then they can't be signing you up for cards with that deferred interest that I mentioned earlier. Oftentimes, the dentists will refer to that plan as a zero interest payment plan or a promotional plan. So you will never hear the phrase deferred interest from a medical provider, but so just be watching out for that. If you hear those words, that might be what they're referring to. This is a big one. They cannot be providing you help with the loan application. So they cannot be filling out part of that loan application or credit card application for you. This happens a lot where folks will be told, oh, you can start a payment plan. Can I just see your driver's license? And then the dental staff will take the driver's license and then they'll just fill out the whole form for the person with their address and name and age and everything. And then they'll just give the forms back to the person just to sign. That's illegal. You cannot be given any help in filling out the application. And then the second one that happens a lot is that you can't have the forms be filled out in the exam or treatment area. So if you're sitting in the dentist chair and they're handing you forms to sign, and then you get signed up for a credit card, that was illegal. That happens a lot. It's got to be out like in the waiting room. And then lastly, you have to be given all the loan details before you sign. So these are like disclosures like the interest rate, late fees, payment schedule, all of that jazz that you would get with a normal credit card, which the dentist almost never gives to the person before they sign up. Okay. So similar to the hospital thing, if you think your rights have been violated, if you walk away with one of these cards after going to the dentist or you see it in the mail one day, what you want to do is dispute the charges directly with the bank as fraud. And you tell them, what happened and which of your rights has been violated. I'm going to be honest, the bank will never agree with you. This is more just a way for them to freeze the card while they investigate, and it will like stop any interest from accruing, and then you won't have to make payments for that little period. And then it'll create a little paper trail for you to make sure that you did your due diligence and talk to the bank. What you want to do then is you want to submit a complaint to the different government agencies, and they're going to go to the bank or to the dentist and ask them to cancel the card or to refund the card. So these are the different government agencies you can go to. It's kind of a lot. I would just say that you could come to a legal aid organization like Public Counsel and ask for help. We submit these complaints on people's behalf all the time. But the big ones are going to be the CFPB, which is the federal regulator for these banks. I mean, Trump has basically like de-staffed them, so they don't work anymore, but they're there. California, the Department of Justice is the state organization that might do something about it. And then if you want to submit a complaint against your medical provider or your dentist, again, in California, you have got the Department of Justice, and then you've also got the dental board, which regulates our dentists. So they all have online complaint forms that you can fill out. At the end of the day, the government may not be that effective. Just so you know, they will require the bank or the dentist to give you a response. But it's really important that we all still submit complaints if we see this happening, even if we're not going to get our money back ourselves, because once they see a pattern of enough people of this happening to, then they may sue the bank on behalf of like the whole state of California. So if you don't hear anything back, it's not that your complaint was useless. It's just going to take all of us to kind of work together to get them to pay attention. Okay, so like just basic advice to take, if you have to take anything away, I know that's kind of a lot of information to throw at you. Don't put medical expenses on a credit card right away. Try to see if you can get financial assistance if it's a hospital, or on a payment plan directly with the provider. So avoid those sort of like franchise dental chains like Western Dental. If you can, try to go to like a family dentist or a local dentist. They will oftentimes be more open to having payment plans. Don't sign any forms that you don't understand or that they filled out for you or that they're giving to you while you're sitting in the dental chair or examination room. And then if you do get sued on a medical debt, don't wait to respond. You have 30 days to respond, so please come to us if you get something at your doorstep that says lawsuit. Okay, some things you can do. Request financial assistance forms from your hospital. Dispute your hospital bill if it is in collections and you do not receive financial assistance forms, and they have to leave you alone right away. And then always read any forms that are given to you to sign and ask questions if you're confused. Just because they're a doctor doesn't mean they know financial stuff. And then submit a complaint if you think any of your rights have been violated, or come to us to help you submit the complaint. Okay, I will end there. I know that was a lot. So any questions? Yes.
Regarding annual credit report document, as we know, tragedy is packed, and a lot of that is months, and we've got another for a year. Is, to the best of your knowledge, is annual credit report document pretty safe as far as there's cybersecurity there, let's say,
I don't think annual credit report stores any of your information. It's more like a website that then sends your information to TransUnion to give you the credit report. So like it itself is not a credit reporting agency. But beyond that, I'm not sure. Yeah, go ahead.
Excellent. Thank you.
Yeah, thank you. Yes. So if you're like out of network, well, they'll just tell you you're out of network, and that you'll have to pay like the uninsured amount. We don't typically see cases where people are being like outright denied treatment. It's more that they're given treatment and then they're just given a huge bill for it if they're out of network. Oh, dentists. I think what we've seen is that, for example, like you'll go into the dentist and you'll tell them you're on Medi-Cal, and they won't deny you, but they'll tell you like, oh, if you need a bone graft, it's not going to be covered by Medi-Cal, and then they'll try to sign you up for one of these credit cards. So they won't like turn you away. If anything, they'll try to just upcharge you and sell you a credit card. Oh yeah, go ahead. So if you don't want the card, but you do want well, first of all, oftentimes these dentists are signing people up for treatments that they don't actually need. They're not medically necessary. So the dentist will say like, oh, your gum line is receding. You need to get this like special fluoride rinse or something. And it's actually not a fluoride rinse that like another dentist would actually recommend for you. Oftentimes they're trying to upcharge you on a treatment that's like, I don't want to say it's quack medicine because I'm not a dentist, but like you will live without that medicine. And so you can just tell them to stop, like tell them you don't want it right away. You could go home, research it yourself, or go to a different dentist and ask for if they would recommend the same thing. And then you can just choose not to get that treatment if it's not something that's actually you need. Otherwise, if it is something that's medically necessary that you need, again, if you're on Medi-Cal, you have the right to get an alternate treatment that is covered by Medi-Cal. So the dentist has to then look around and say, if this isn't covered, maybe there's like a second best option that is covered. And they're legally required to do that, so. Yeah. I don't know if it's a bad thing. Sometimes the private dentists will be more open to putting you on a payment plan instead of signing up for a credit card. So it really depends. Any other questions? Okay. Thank you very much for attending.
So you can stay for a few more questions?
Oh yeah, and if you have like individual questions, I'll just wait afterwards, yeah.
All right, so thank you. So a little personal story here, one of the reasons why I wanted to bring this forum to the community. So I'm a little bit older, but I still work full-time. So I had CalCare as my healthcare provider, making my, premium payments to CalCare with a subsidiary. So I got a wage increase where I work, and I no longer qualified for it. So instead of paying $50 a month, it went up to $800 a month, which I wasn't going to pay. And it was just like, it happened at a weird time. And so I couldn't get on another health plan, So I really went for about 10 months without health insurance, right? And so then I got on a health insurance plan, and the plan that I got on, they are not making the premium payments. So it's like, do I have health care? Do I not have health care? It's really crazy. So even though I'm doing all the right things, you can be, like I said, I got disqualified from CalCare by getting this small wage increase at work, which is just really crazy. And then now where I work, they're not making the premium payments. This is for the second month in a row that they're not doing this. So this is really concerning, and it's not like I got unemployed and I have a medical emergency or anything like that. So anything can happen, and you have no control over this. Even today where I work, a lady got fired where I work, and she's in tears because she didn't know she was going to get fired, and pay rent and medical and all that kind of stuff. So she's just in a bad situation when she was leaving work today. So very, very concerning. We don't know what's going to happen at what time, anywhere. So one of the things that you may have seen this on the table coming in, this is the next event that I'm bringing to the community. It'll be here in the sanctuary. WMSV, short for Words and Music, Sound and Vision. So it's Saturday, October 11th. It's National Coming Out Day. And you normally don't see any kind of celebrations or anything for the LGBTQ population on National Coming Out Day. We honor it, we email each other and all that kind of stuff. Oh, it's National Coming Out Day, yeah, hooray. But so what I'm doing is going to bring movie clips, music videos, and spoken word to celebrate the day, to validate people. And I also think that it's important that whether you're younger or older, to be visible in the community, and I'm very visible in the community, and to be a role model and to be out there, because you saw on that one slide, I'm a huge advocate for social justice and environmental justice. And I have younger people coming up to me saying how do I do that? How do I learn what you do? That kind of thing. So being visible really helps. I have a huge network, and I appreciate, Pastor Dan giving me the opportunity to do something like this tonight and doing this next month. So we're going to be blasting it out to our networks, and hopefully you guys can come back next month for that. Again, it should be just a casual evening. It is Saturday night, early enough where you can go to dinner, come here, and then go out drinking or partying after. I get it. I've done all that. But really looking to do something a little bit different and to really, work with the community and, bringing a different aspect of the LGBTQ culture or pride or movement into the community. So was it a couple years ago, here in the social hall, I did an honor our LGBTQ Elders Day, which had a standing room only. There were so many people that turned out for it. It was really awesome. And I've done a community forum on civic engagement, and I've done a community forum on seasonal affect disorder or depression during the holidays. And it's not uncommon for me to go to any college or university in the area and talk to students about LGBTQ health disparities, challenges of aging, or all this kind of stuff. So I'm actually kind of basically your community subject matter expert on LGBTQ stuff. I don't have a peer that does this in the county, so I'm really in a very fortunate position where I kind of bring these things out. One of the things that I didn't mention, though, and I think because we have our students over here from Cal State Long Beach, is that I am a community healthcare worker. I got certified by Mercy College of Health Sciences during COVID, so it was a 2,100-hour course. So it was a really big course with lots of labs and all that kind of stuff. But again, to have an out LGBTQ community healthcare worker coming into the community and talking about health issues, and I kind of specialize in brain health, so I do a lot of research on cognition and vitamins and diet and all that kind of stuff. So this is the kind of stuff that I specialize in. So once again, thank you for coming tonight. David will hang around a little bit more for more questions, and thank you again for coming.